Excited to have you all here for a really interesting conversation around how to choose the right birth control for you and for your body. So sorry if you wouldn't mind going to the next slide. Perfect. So I'm going to be your moderator today. My name is Shaji and I'm the co-founder and CEO of Tune. At Tune, we fundamentally believe every one of us should understand our powerful and unique hormones and get personalized birth control recommendations that are fully in tune with our hormones, our unique biology, and our goals. So I'm going to pass it over to Laura, our medical lead, to introduce herself, and then to the lovely Jack.
Hi, everyone. I'm super excited to be here today. I'm the medical lead at Tune. I'm a gynecologist. I've worked in face-to-face consultations until 4 years ago, and then transitioned to digital healthcare. I'm absolutely passionate about digital health and looking for new ways to provide the best solutions to patients. Over to you, Jack.
Hi everyone, my name is Jack. I'm the Medical Affairs Manager at Natural Cycles. So I've been at Natural Cycles for around 2.5 years, teaching healthcare professionals about the app and heading up the research there. And before this, I worked as an embryologist in a UK fertility clinic, and I did a PhD in reproductive medicine. So lots of science and lots of juicy science to come, hopefully.
Perfect. Thank you both. Awesome. So what we're going to cover in today's webinar, the main topic is there is no one size fits all. And you really need to understand the pros and cons of each available method and make an informed decision based on what are your needs right now, what is best for your body, and what is happening to your body. We will also cover all available birth control options and aim to give you objective information on the pros and cons of many different methods. We will be also providing you with some exciting tools so that you can take to your medical doctor and have some constructive conversations about your birth control. We'll answer, as Laura said, we'll answer all of your questions at the end of the webinar. A few housekeeping rules. We won't be providing personalized medical advice in this webinar. Additionally, I'm sure you all know, but we won't tolerate any hateful language. This is a safe space for us to educate ourselves and to be able to sort of make informed decisions. I'll pass it on to Jack to get this started.
Absolutely, thanks, Shadi. So here we've got a really nice timeline, just thinking back to how we got here with birth control. So I was doing a little bit of research this morning, having a look at some very, very ancient birth control options. And it kind of got me thinking about a world without birth control, which actually wasn't very long ago, especially not having the birth control that we do have today. But let's go back to sort of the 1960s, the pre-1960s. There were some calendar and rhythm methods around where you could be sort of tracking your cycle with pen and paper and having a look at when you could have sex, when you were fertile or not fertile. So this was fertility awareness-based methods that were kicking around then. And then just in 1959, 1960, the first hormonal contraceptive was approved in the US by the FDA, and it quickly got its name, the pill. And then moving through the 60s, the IUD, or the intrauterine device, the coil, got approved. And there was quite a lot of innovation and advancement in this time. Through the 80s, more pills becoming available, and long-acting contraceptives, right through to the 90s, Plan B. And then it kind of slowed down and it went a little bit quiet. And this is where Tune and Natural Cycles are coming into this femtech space, in the sort of innovative space of digital health. And today we'll be talking about that a little bit as well.
So one of the things that we wanted to show you with this slide is that there are so many different contraception options. There are 16 different types, there are more than 200 different brands. So you can imagine how important it is to individualize contraceptive recommendations to find among all these ones, which one is the best for each person. So one of the questions that we wanted to ask you is, how many birth control options have you been offered by your doctor? So if you want, you can reply to this question in the poll section, and we can comment.
I haven't quite gotten the polls to work, but if you feel comfortable pasting in the chat sort of how many contraceptive options you've been on in the past, then we can all have a discussion around it. And alternatively, if you don't feel comfortable, please don't worry.
Yeah, absolutely.
Yeah, so I just saw some numbers coming in. I think there was 4 and 2.
Yeah, gonna give some more seconds, but yeah, absolutely. Like, I think the experience for most women and people with cycles is that they frequently get offered very few options, and there's many of the other ones that are absolutely unknown, or you just heard of it. So one of the things that we wanted to reinforce here is that we need to know the options to be able to individualize contraceptives to each person. And so, not to make you more confused, but looking into some details for some of these contraceptive options, this is how we usually separate them. We talk about long-acting and short-acting contraceptives, depending on how frequently you need to renew them for them to be active. So if we look at the long-active, we can divide them between reversible and non-reversible. So non-reversible would be those ones that you wouldn't expect fertility to go back to normal once you've done them. And so we've got female sterilization and male sterilization, whereas the reversible ones, we can divide them in hormonal and non-hormonal, but those ones are long-acting, but you would expect fertility to go back to what was expected at that age once you stop using them. And here we've got the coil, which can be the hormonal one, or the copper, the implant that lasts 3 years, or the injection that you need to renew every 3 months. And then on the other side, we've got the short-acting contraceptives that can be hormonal and non-hormonal as well. The hormonal ones, you probably have heard of the pill, which can be a combined pill if it's got 2 types of hormones, or it can be the progestogen-only pill. And then other hormonals one are the vaginal ring or the patch. And then in the non-hormonal, you see there's lots of options as well. Probably heard of male condom, female condom, and we wanted to also talk about natural cycles today. So I'm going to hand over to Jack.
Absolutely. So now we're going to talk about sort of your unique cycle and some of the myths about cycles that have been out there for a really, really long time. So when using natural cycles, one of the main findings that we have from our users is that they learn lots about their menstrual cycles, things that we maybe should be taught about at a very young age, very basic things about our biology. So one of the biggest feedback we get is that I didn't know that my cycle looked like that. And a lot of the time our users are saying, well, my cycle has variation and I didn't know that was normal. And given that we're collecting lots of data at Natural Cycles, we were able to look into this, and we found that actually only 13% of cycles are 28 days in length, and 28 days is the standard length given to sort of clinically most women's menstrual cycles. So it's actually a really small number of cycles that are not varying, and lots of things can influence this. So diet, exercise, stress, and how you're feeling in your life. So there's a real need here for individualization. There's definitely no one-size-fits-all when it comes to your cycle and to your contraceptive choice. And there's a real need for personalization too.
And it's really interesting because when you go to the gynecologist or your doctor and talk about contraception, I'm sure that most doctors aren't asking these questions about your diet and your exercise regime. And so it can definitely get more and more confusing.
Absolutely. And as you can see laid out in the graph there, sorry, Sarah, as you can see laid out in the graph there, we can all sort of have set points for a cycle, but it really can vary within an individual and definitely between individuals too. So it's just good to bear that in mind.
Yeah. And it's great to have clarification on what is a cycle, because I know, there's lots of people who confuse the full cycle with just the days that you have your period, right? And so this is really useful in thinking about a number of things about what birth control you're on.
Absolutely.
Cool. So in thinking about, what access do people have globally, it varies depending on where you are in the world. And so we thought, because there are people on the webinar from the US, from the UK, and from other parts of the world, we thought we'd talk a bit about, access and options globally as well.
Yeah, absolutely. So if you look at the right part of the slide, you will see how length of the consultations, general consultations have varied during the last years, and that is for the UK, Australia, and the USA. And you can see that it has, well, at least for the UK and the USA, it has improved a little bit, but we still think that it is not enough. It is very difficult to be able to, during a first consultation for a contraception, to assess everything, the symptoms, the preferences, talk about the side effects, what are the good things that could provide a contraceptive, and so on. It is very difficult to do that in 10, 15 minutes. And so one of the things that we think is amazing nowadays is that we have digital healthcare, and we have digital solutions that allow us to provide all that information whenever we want, with the time that we need to give those information, so that afterwards we can receive a very individualized solution for that. Thank you. So one of the things that we wanted to show you is that the preferences vary quite a lot worldwide. So in each row, you are going to see different regions of the world, and the colors correspond to different contraceptive options. And you can see that it varies quite a lot. Not just the contraceptive use, that you can see varies from 30% to 60% in different regions, but also which contraceptives specifically they decide to use. And there are many things playing here. There's cultural preferences, can be from the doctor or from patient side. Both of them play a role. Can be religion, it can be easy of access to the contraceptives or the follow-up needed. So there are many options out there, and you need to discuss all the things that can play a role when you go to the consultation.
Absolutely. So this is a fantastic table. If you just go back one, Sarah, sorry. Perfect. So this is a really nice table, just talking about the range of contraceptives and birth controls that are out there and their effectiveness. So when I started at Natural Cycles, I had no idea that there were this many contraceptive or birth control options out there. So as you can see, the ones that are shaded, they are the non-hormonal options. So we're just going to go through the effectiveness first. So first of all, you've got something called typical use effectiveness. And this is the effectiveness of the birth control when you're using it day to day. So this involves maybe forgetting to take a pill, or measuring your temperature, not measuring your temperature, for example. Or having sex on a red day in the app, or a fertile day if you're using fertility awareness. So this is sort of how the birth control performs in the real world. And then you've got your perfect use. So this is if you use the birth control perfectly and you don't make any sort of slip-ups or mistakes. And often perfect use is better or higher than the typical use. So those are the two columns in the middle. And then the one on the end is quite interesting. It looks at how many percentage of individuals that are continuing to use a birth control method after a year. And we know that satisfaction is a huge contributor to whether you find the effectiveness of a birth control. If you're finding a birth control really difficult to use, if it's not suiting you, if you're having side effects or the routine doesn't suit you, then you're much less likely to achieve perfect use, and it's going to be less effective. So let's just do a quick comparison. So if we take the male condom, the typical use effectiveness, or the Pearl index here, is 13. So it's 87% effective if you're just using it day to day. However, if it's used really well, it goes from 87 right up to 98% effective. And if we look at something, so one of the sort of older fertility awareness methods, we'll take the standard days method, you're getting 86% typical use, going up to 96% if you use it correctly. So it's, again, first of all, really good to know all of these options. And what are they? What do they involve? Will that suit me? How will that feel? And it's really good to know this when you go to your healthcare professional, so you can sort of take a selection, ask more about them, and be empowered in that consultation. And then I'm just going to really specifically touch on fertility awareness. So this is a non-hormonal method that's moving into sort of femtech and an innovative space. So as I mentioned at the start, there used to be calendar charting, which you can see here next to the cup of coffee. You can still absolutely do this today, where you're taking your temperature or looking at cervical mucus, you're making a note of this and you're charting your cycle. So it's quite labor intensive and it involves a bit of written work. And then you can basically then map out your fertile days. When am I fertile? When am I not? And you can use it as a birth control, or you can use it to plan a pregnancy too. And there's many calendar tracking apps out there that just use dates, which is similar to this method, just computerized. And then there's other methods where you use something called a biometric. So I'm talking about something biological. You can measure temperature, your LH, or interpreting your cervical mucus as well. And that's where Natural Cycles comes in. It's computed, it's a sophisticated algorithm, and you can use it in much the same way, cleared by the FDA and certified in the EU for use as a birth control. So let's have a little think about contraceptive choice as well. You're going to your first, or you've been to many contraceptive appointments with your healthcare professional, and it's good to think about these three things. So what's right for you? Ask yourself about effectiveness and pull those figures online from a reliable source. Is effectiveness really important to you at this stage in your life? Would having a baby be really, really would it be detrimental to your plans in the near future? So think about effectiveness. Is that really important? And then consider the side effects. Have you been on something before that's just not worked for you? Or do you want to just know a little bit about what side effects other people report? Is it invasive? So is it going to involve a procedure? And see how you feel about this. Or does it involve commitment? So am I taking a pill every day? Am I recording my temperature every day? Do I think I can do that? And it's all about empowering you. So it's nice for you to go to an appointment with information too, and not just relying on the healthcare professional. So you'd like to know the facts and figures and any questions that you have. And you just want to be fully aware of the options so you can make that informed choice. And then also there's some other clinical requirements as well. So when you need an appointment and why. So most contraceptives, you need to visit a healthcare professional. There are some that are direct to consumer, like Natural Cycles, but it's always good to discuss them. And as I said, most fertility awareness methods do require a bit of training, either within the app or reading online. And then obviously, if you're repeating a prescription, you'll need to go back. And if you're suffering some side effects, you might want to discuss those too. And then just one thing I wanted to touch on is that there are some things that you can take with you to your consultation. So first of all, recording your symptoms, recording your side effects if you're having any, jotting down your thoughts on effectiveness and on things that we discussed on the slide before. And then also you can pull some great information online that is there for healthcare professionals. So if they're unsure, you can go through the questions together if they've got time. And we won't go through the details of the slide, but there's lots out there online that you can take with you to feel ready and prepared and empowered.
Perfect. And we'll publish this all on the Toon blog in the next 24 hours. But, these are things that Jack has shared, that healthcare professionals get trained in having those conversations with patients around contraceptive choice. So it's really important for you to know what the doctors are trained to do, so that you can go in and make sure that you feel like you can have an open and honest conversation with them about what's right for you.
Absolutely. And I think sometimes doctors, healthcare professionals everywhere are incredibly busy. So if you can take some things with you to help them, it's only going to benefit you, and it will bring
recorded
Hi,
in our
everyone.
super
Super excited.
blog and onto YouTube as well. So over to you, Shardy.
Awesome.